I started my career around 40 years back. And when I started my career, the nursing was perceived in a different way. Actually speaking, those who fail to get MBBS, they enter into nursing. The cutoff were so high to enter into nursing. So if you see those people proficiency and everything, it is very different compared to the present day. And moreover, gone are the days we had only, it was considered as a female dominant profession. For example, even the government was permitting us, or the regulatory body, Indian Nursing Council, was permitting us to take 1:10. That means every 10 girls, only one boy will be admitted. So every college, most of the colleges prefer to go for only females admission. So, but if you see now, the scenario is completely different. Though it is a noble profession, but it is lucrative in nature, and the boys are coming forward to take up this course very interestingly. The demand has been created because globally the curriculum is being accepted. Whatever we are training in nursing, it is also matching the needs of the global demands of the patients. We are not only covering just the core subjects like taking care of patients with the chronic diseases or acute illness and obstetric care. No, we cover 360-degree. The nursing is the only curriculum which covers arts, science, and I meant to say it is amalgamation. It is covering even the management, administration, and everything, so that as a nurse, she will be able to provide 360-degree care, or I would say that holistic care to the patient. Satisfaction is there, but only thing, the financial satisfaction is not there. Mental satisfaction, 100% we are all getting. Either we work there in the teaching institution or we work there in the hospital. If you work there in the hospital, the satisfaction which you get is very high. It cannot be compared with anyone. Once the patient gets discharged and go, the way they bless is a real blessing that no other profession will get. I feel even the medical profession don't get this kind of blessings. The blessings is directly given to the nurse who is really taking care of them. Nowadays, what I feel is somebody has to sit and talk to the patient. That is very important, which is missing in our healthcare system nowadays. So the nurses are the one who are able to maybe satisfy that needs. But at the same time, I feel the current day system, because of NABH standards, JCH standards and everything, that is making the nurses to run around the documents than providing the bedside care. That system has to change. Of course, we need standards in patient care, and the patient safety is very important, but at the same time, the real nursing care is missing nowadays. But even then, with the available time, they are able to make it up. Nursing, if you see, even in the subject itself, while teaching our students, we cover the ethical points and the legal and ethical issues which they face there in the hospital, and how to handle those issues in the hospital. Also, we prepare them with the professional ethics and standards. When they go and work there in the hospital, because all the time, 24/7, nurse is the only healthcare worker who is there with the patient. So they communicate to them. They know, even in our curriculum, communication play a major role. We tell them how to communicate to the patient and how to create a interpersonal relationship with the patient, so that it starts at the time of admission and it ends once the patient gets discharged. We also teach them about how to keep the boundaries with the communication. So they know how to communicate to the doctors, how to communicate with their own healthcare team as well as the patient. And moreover, they get complete satisfaction. Gone are the days that doctors were so ethical and they felt that this is a service which we are giving to the mankind. But nowadays, because of the intrusion of these corporate companies and so many hospitals are there, that hospitals are giving the targets to the doctors. So they have to achieve that many targets within that stipulated time. So even if the patient come to the hospital for simple illness, they start charging high and they make them to undergo all the possible investigations, and it is really creating an economic burden on the patient side. But whereas in nursing, you get a complete sense of satisfaction when you give care to the patient. You need not to answer to any pharma company, you need not to answer to the management or anything. As long as you follow your ethical standards and you give the complete care and you ensure patient safety, definitely you will be able to get satisfied, unlike medical profession. AI in nursing is already there, and we started incorporating this artificial intelligence not only in the curriculum, in research. So there are so many platforms nowadays available. Even the young generation students are so much fascinated towards the AI than the normal human brain. Our profession is always having a dual role to play. Our faculty are there with the students in the hospital for half a day every day, and afternoon they come for theory block. This is what our pattern is. So they know that wherever the AI is used, they are able to make use of them in a perfect way. There are so many patient monitoring devices are coming up with the help of AI, which is the boon for the profession. But at the same time, we have to see the reliability of those things. AI in teaching side, if you see, uh, we have recently conducted one FDP, that is a faculty development program on gamification in nursing education, where we learnt many things from the engineering department. I started doing all these collaborative projects as well as the collaborative learning environment I am creating there in the College of Nursing side now, because nursing is no more a single profession. Now it should be collaborated because of the technological advance, especially as you said, AI is very important. That is leading our daily life. Everybody has to update their skills. With that sense, we arranged that FDP. It has got a good welcome from our faculty, and they learned how to handle today's kids. Today's children, their span of attention is hardly 20 minutes. After that, they cannot sit at one place and they cannot concentrate anything. So through the gamification method, how you can make them engage, how you can make them to learn those particular concept, that was really helpful. And they shared some of the various platforms also, free platforms as well as some paid platforms, how the teachers can make the students to attend the classes interestingly using some AI.